These are phrases that you can use in the examination room to determine the location or source of pain that a patient is experiencing. Does it hurt? ¿Le duele? ¿Le duele? Where does it hurt? ¿Dónde le duele? ¿Dónde le duele? Point to where it hurts. Señale dónde le duele. Señale dónde le duele. What hurts you? ¿Qué le duele? ¿Qué le duele? Does your head hurt? ¿Le duele la cabeza? ¿Le duele la cabeza? Does your arm hurt? ¿Le duele el brazo? ¿Le duele el brazo? Does your ear hurt? ¿Le duele el oído? ¿Le duele el oído? Note that oído means specifically the inner ear, and for pronunciation, the O and the I are pronounced in separate syllables, and there's stress on the I because of the accent mark, so it's oído. There are 3 syllables in this word, so oído, oído, oído. Does your ear hurt? And here we mean the external part of your ear. La oreja. ¿Le duele la oreja? ¿Le duele la oreja? Does your stomach hurt? ¿Le duele el estómago? ¿Le duele el estómago? Does your back hurt? ¿Le duele la espalda? ¿Le duele la espalda? Does your neck hurt? ¿Le duele el cuello? ¿Le duele el cuello? Does your tooth hurt? ¿Le duele la muela? ¿Le duele la muela? Do your feet hurt? ¿Le duelen los pies? ¿Le duelen los pies? Do your eyes hurt? ¿Le duelen los ojos? ¿Le duelen los ojos? Do your ears hurt? ¿Le duelen los oídos? ¿Le duelen los oídos? Do your legs hurt? ¿Le duelen las piernas? ¿Le duelen las piernas? Here's a brief explanation of the grammar behind the verb doler for those of you that are interested. So doler is classified as a gustar verb, and if you're familiar with gustar verbs, you know that they function differently than other verbs. Most verbs will follow the subject-verb-object pattern, but doler is different. You have an indirect object pronoun first, then the conjugated verb, and then really the subject as at the end, because the form of doler corresponds to whether the noun at the end is either singular or plural. So in the case of the singular nouns here, what I'm really saying is the head hurts to me. Me duele la cabeza. And notice in English you would say my head hurts, and many students have the tendency to say me duele mi cabeza, my head, but that's not necessary because the me indicates to whom it is occurring. So you just have to say me duele la cabeza. And I know that sounds funny if you're an English speaker. To me, hurts the head. But this is the way the idea is expressed in Spanish. So if I want to say my ear hurts, really what I'll say in Spanish is to me hurts the ear. Me duele el oído. My foot hurts. To me hurts the foot. Me duele el pie. So that's how it functions. If the noun is plural, for example, if I want to say my ears hurt, I will say in Spanish, me duelen los oídos. To me, hurt the ears. My feet hurt, me duelen los pies. To me, hurt the feet, literally. But, again, this sounds very normal in Spanish. If I want to ask someone a question using usted, if I'm being formal, I would choose le. For example, if I want to ask you, does your head hurt? I would say, le duele la cabeza. To you, hurts the head, literally is what I'm saying. If I'm being informal, then I would say, te duele la cabeza. So normally you would use the informal if you are a medical professional talking to a child or someone significantly younger than you. You would say, te duele la cabeza. But if you're being polite, you would use the le duele la cabeza. Well, I hope this helps you understand the verb doler a little better. And I know your Spanish-speaking patients will really appreciate your efforts to communicate with them in Spanish. Remember, practice makes perfect.